So welcome to Her Body and Mind podcast. I'm Amanda Sarich, and this is
Dr. Sierra Fox.
So today we're going to talk about ADHD in women, why women are so often missed in ADHD diagnosis, and we're going to have a case study from Dr. Fox.
I am the case.
She's the case. So yeah, we're going to see how it goes. We are having a conversation here. Like when we talked about why we made this podcast, we talked about how we're always having conversations in private and we wanted to like bring those conversations to the world. We haven't actually had this one. We haven't bits and pieces and that kind of thing, but a real kind of like breakdown of Sierra's like diagnosis and all of those things. We haven't done that in this way. So it should be really exciting.
Yeah, I'm excited to see what you say about my past and my present.
We'll see. See if we're still friends after this episode.
Oh, yeah. Okay. Well, why don't we start off by talking about just like what is the deal? Why are women just now starting to get acknowledged and diagnosed with ADHD? So like the bigger picture, so to speak. So thoughts on that?
Yeah, I think the biggest thing is women, have been misunderstood since the dawn of time. And I think this is no different. I think that most of if we look at the creation of DSM and diagnostic criteria, like who created those? The men. And so most things have been, for a lot of diagnoses have been through the male lens. And so in that, there's a lot of reasons why women have been missed in this space, but I think that's a big part of it.
Yeah. Back then they truly did believe that it was like a little boy specific or a male specific condition, whether that's their perception of it being like genetic to that sex, but like that's how it was viewed generally speaking, whether or not that's actually what they were thinking or not. But
well, yeah. And I think like women in general are like taught to be like, we're really good at masking. We're really good at like being quiet. We're really good at internalizing our own symptoms. And like historically this has been put onto women as like a flaw instead of like conceptualized as like, is this a diagnosis? And so that's true for a lot of other diagnoses, but particularly ADHD.
Yeah. Cause it's just like social process. So putting aside the DSM-5, it's just like, generation after generation after generation, like we raise boys a very specific way and then we raise females a very specific way. So girls are just like sit still, be polite, don't talk a lot, versus like it's more socially acceptable for boys to act out or be hyper, or boys be boys are just being boys. So I think that like along with that, it's just like parents generationally passing down information, as well as then in the medical system as well, as like
the social constructs that we put women and men into, the traditional all those things. And yes, there's many other categories, but if we're talking specifically of like male, female, looking at that today. And I think if we look at ADHD, the inattentive kind of category of ADHD is going to be a bit more common in females. And that's not going to present the same way. They're not in the classroom jumping up the wall. They're harder to spot, but we also weren't looking for it.
Or you mean like hyper, that's more the hyperactivity, impulsivity. Yeah. Versus inattentive. Females are you're more likely to catch that. Yeah, for sure. And then speaking of school systems too, that's like another kink in the chain as far as like, well, why aren't we identifying this? It's just another huge social system that's responsible for a very large population of people, developing the humans. And two, like no one was taught, teachers weren't taught this. They were taught, very little, if anything, even in relation to boys. Like even boys were underdiagnosed, but at least diagnosed. And so that's like another, piece of the puzzle where that's often where they
in the 80s, we had a lot of kids on Ritalin who actually just had complex trauma histories too, because, if we look at what's the word if there's two things of the same thing?
Comorbidities?
That's the one. There's a lot of that, especially with trauma. So that's like another thing too, is that women are so often put into like other categories when it is so clearly ADHD. But again, it wasn't the hyperactivity piece that was like so blatantly obvious, especially as we moved past the 80s, 90s, early 2000s. The inattentive one just like was on no one's radar. Plus, I think you talk about female masking, like we're like trained
masters,
by society to be like the best of the best when it comes to the mask.
100%.
We've got to do it.
Yeah, I can relate to this for sure. No, so that's another big piece. Other elements as far as like misdiagnoses, I think even education around like what's a learning disability versus ADHD, right?
Yep.
That's like part of my story too. It's like it was actually okay to have I knew that I had a learning disability growing up, but no one ever thought to think that it might be related to inattentive or hyperactive ADHD. So it was a symptom of something, and I could have both for all we know. I never got assessed for learning disabilities, but yeah,
I did. I have learning disabilities. I was assessed, but same thing. It was the 80s. So I was assessed and was like assessed for, I think, pretty significant learning disabilities, but then like nothing happened with it. It was just like, okay, there was no support, no extra, any of those things. Right. But then still was never assessed for ADHD. And so now there'd be a lot more of that, like, in present day assessment, ADHD, especially in kids, it's way more like, well, let's just screen for this. Whereas before it was not really a thing at all.
No. And I mean, this is not gender specific, but I know a lot of parents just don't want their kids to have the stigma of.
Yes.
And that's like another huge barrier, and that's like a parent thing where they just don't want their kid to have the label of a learning disability or the label of ADHD. And so even if it is brought to light, sometimes it's just no one does anything with it because it's viewed as this negative thing that might bring them down.
Which is really tricky because if we look at a not diagnosed ADHD, or even I can speak to my own like diagnosis of learning disabilities, is that it's internalized. Yeah. So if you grow up with like, let's talk about female specific, say inattentive ADHD that was never caught. Yeah. What do you do with the fact that you are and do operate a bit different than everyone else? You internalize it and it becomes part of a character flaw and part of this thing that's wrong with you, instead of the fact that your front brain just does not have enough dopamine, which is not something you can control or change by like willing it away. It's a very, very serious diagnosis that is very real.
That made me think of like, and not to knock you, but there's this joke between Amanda and I and maybe some other people, just like, Sierra, you're not for everyone.
It's a joke. It's true.
Legit, that's like a joke.
Yeah.
It was a joke, and it was compounded in like very specific like traits and behaviors of myself that like she can tell you more as to why she said that about me.
It's true.
But like there's like one thing is not like the other. Like I'm different from a lot of other females in very obvious ways, and that was just a joke before we knew I had ADHD.
The joke came up in like a some type of like tarot card reading. It came up and then we were all like, yep, that's the most accurate thing.
Oh yeah.
It wasn't even me. It was the universe.
Or something. I don't know. Yeah. But it's just like been a joke since. But that's just like, it clicked for everybody. It made sense.
It did.
In relation to me.
In relation to you.
In relation to me.
Absolutely.
Now, like, why do you think things have flipped? Like, what has changed? Why are we suddenly like diagnosing females now? Like, that's another thing I'd say in the last, I don't know, like not even 5 years, I would say. It's happened pretty rapidly.
Yeah, I think that part of it is information. I think that, the internet has a lot of bad, but it has a lot of good, and that a lot of people are seeing things on like Instagram and TikTok, or maybe like a really cool podcast with a counselor and a naturopathic doctor. And they're like, oh, like that's me. And so there's a lot of information. I mean, we've talked about algorithms before, but if your algorithm gets kind of flipped that way, there's a lot of information out there. Mm-hmm. And I think there is a lot more research. And so I think professionals are getting a bit more attuned. Like I know for me, it's 1 year ago, when I went to do like my CEs, there was a lot more than had been there previous.
CE is continuing education.
Yes, correct. Yeah. There was a lot more than had maybe previously been there, even like 5 years ago, about like ADHD and learning about it and assessing it and understanding kind of like the complicated dynamics of it. So I think there's probably like a multifactorial answer to that question of like, why now? But I think, I just think it's more information, and I think things are slow. And so we're getting there.
Let's talk about our education. Let's talk about what we learned about ADHD in our education.
Yes.
So you have a degree in psychology.
Correct.
And a master's in counseling.
Yes.
So within those two kind of stints of education, like what did you learn?
Well, I can tell you exactly nothing.
Yeah.
Zero.
That's crazy.
Zero. Maybe it was brought up, but not to my recollection. There wasn't like a course on it, or it maybe was brought up in passing, but very, very, very little. I've done a lot of my own education, understanding, research, all the things to understand it better so that I'm like able to help my clients.
Yeah.
But I think that's true for a lot of different things, and that these programs aren't always equipping people properly. What about you? How much did you learn about it?
Yeah. So undergrad, I mean, I have a degree in kinesiology, so that wasn't like part of it, right? So to be fair, there, like, obviously I knew of it, but I don't know that I could say there was a course that touched on that particularly. And then even in like med school, like, again, like I'm 40 and just found out this year, and I've been a doctor for 7 years. So that speaks volumes about a lot of things. Cause I wasn't looking for it until recently, but you have to learn so much in med school. So like you're kind of scraping the surface on a lot of topics, but never getting deep about anything. So when you come out of med school, whether it's naturopathic or regular medical school, you know a lot about a little about a lot. Yeah. Like that's kind of what you are. And so anything that you want to know more about, you really have to do like the work, which is really hard when you're seeing like high volumes of people. But I digress. So in my school, it was more like DSM, like this is the DSM. And then we talked about treatment, and more on the naturopathic side. We didn't learn a ton about stimulants or alternatives to that from a pharmaceutical perspective, unless you elected to take the pharmacy course, in which again, you skim every single drug, but you don't know a lot about anything. So even they didn't talk about female specific anything. And I mean, like, as a profession, we pride ourselves on being more holistic and like, but that just, it wasn't, I can't say that a single course touched on like the difference between the two. And it was really just me wanting to learn actually more about how I got myself into a terribly abusive relationship, and trying to like reflect on like this human that I was with, that then came full circle. And I was like, oh, like he had ADHD. So I was looking into like what part of that was part of this. And then I was like, oh my gosh, like, all the reading I did actually then made me realize like, well, that's me.
Well, and like I'm a lot of education in psychology and all these different things. And I've been your best friend for a long time, and ADHD was never, I wasn't like, this is the thing. This makes sense. Right. Yeah. It just was not part of it. And now that we know, like it does, it makes a lot of sense. Like a lot of it makes sense.
Totally.
The other kind of comment I have is that I think when we talk about how more people know now and how it's like on social media, we've almost like flipped the other way, where when I send a client, I'll be like, I really think that you should go get an assessment. So they'll go to their GP, and clients, like GPs have literally said to them, oh, don't jump on that bandwagon. Like, no, like everyone has ADHD. And like, okay, yes, it is, I think, sometimes overdiagnosed now, because it is a really, I think, quite complicated diagnostic process.
Yes, it is.
However, real ADHD is very much a deficit and a big issue to just like live your life with.
Yeah.
And so, it's like now it's like this like trendy thing that women are all like flocking to, because they've been misdiagnosed for so long. Like, you're 40, like that's a long time to have lived with these symptoms inside. So I think we've kind of like gone, like we have in a lot of different things, gone maybe so far this way, but so it's a tricky one.
It is tricky because, like you said, a lot of people think they have it and want to get assessed. And then I think there's a lot of crappy ways, you can take shortcuts to get assessed that then will often give you the wrong diagnosis. Yeah. So then people are getting diagnosed with ADHD because the practitioner who was doing the assessment didn't know how to assess and didn't consider so many other factors that could be the reason for the symptoms. Yeah. I mean, this is like, we'll probably have many other episodes on this, but this is again, just superficially like the thing. So when I actually got diagnosed, like other than talking to my immediate family and very close friends, like I didn't publicly talk about this for a long time or disclose or share, because I was like, but like a lot of people are gonna be like, yeah, right. Like that's not, how is that possible? Like you're a doctor, you're this, like you should have known, but whatever, like all the judgment, you're afraid that people are gonna be like, you're on the bandwagon.
Yep, you like, jumped on.
You got on the bandwagon. I was like, oh, how do I navigate this? And I speak very publicly on a variety of platforms and social media and share a lot of personal stuff, but that was something that I wasn't ready to until I took the time to really understand myself a bit more, or what that even meant for me, my past. Like, it's just it's unfortunate that I had to think that way, but like that was my reality.
But even if we talk about why women are misdiagnosed, it's that women are seen as like the problem, and that their symptoms are never taken, or not never, but have often traditionally not been taken seriously by the general society. So now that we're finding out that women have ADHD and have been misdiagnosed, it's like the same kind of like gaslighty, well, now it's a trend, and that women are just like making this stuff up. So it's the same type of like shame-based internalizing women's symptoms as a problem, instead of just like owning it as something that is like a very serious neurodivergent, complicated brain reality.
It's like a disability.
It's absolutely
it is.
a
And that's
disability.
like me reflecting on my past. I'm like, geez, Louise, like what would have life been like had I been diagnosed when I was young? You know what I mean? Like I just, I had to grieve a bit, to be honest. Like it was
Absolutely.
sad.
Yeah. Let's talk about your story a bit more specifically. So you were diagnosed when?
Gosh, I think it was March of last year. So 2025. So it hasn't even been a year, to be honest. So but I had been looking into it since the previous, I would say May. So May 2024. That's when I started reading books on ADHD and also reading books on abuse. And you know what I mean? Like just like a very
tricky,
muddled, tricky, like period for me. And through reading both of those books at the same time and then learning more, I was like, oh gosh, like I do need to look into this. And then it's so funny. The process of getting assessed, I was like required to fill out like probably a form that took 45 minutes to an hour. And outside of work, because I really have to try really hard to do all the minute details, and like you can't get away with making mistakes basically, but in my own personal life, that was actually a challenge. So the first time I went to get assessed, the lady who went to assess me, she's like, this doesn't make any sense, because my like multiple choice and then my written just didn't like add up to one another. They're like, these are two opposite things. Like you checked this off, but then you said this. I was like, I don't know. So it's actually hard to get assessed just from doing the preliminary screening things. I just couldn't be bothered. And I was like, what's wrong with this lady? Like, why is she not?
But that is a problem in the assessor, is that you were kind of deemed as like almost the problem.
Well,
in
she
that.
told me, she's like, you didn't do it right. You're like, the forms are wrong. And I was just like, what did I do then? Tell me. And then she couldn't. And then I like has to escalate this and talk to the owner of this place. And then they passed me to someone else. And then this next person who assessed me, she was like, oh, well, when I saw that, I just saw someone who had a very clear disability, who couldn't spend the time to fill out the paperwork, who couldn't focus, that just like didn't care. You just didn't care about it. And like, that's true for many, like what I would say, like tests that I don't really care about.
Yeah. Like Sierra texts very uniquely. And I think it's been one of those things it's been forever. I just sent you a reel a couple days ago about ADHDs and texting. Cause I'm like a detective. I'm like really good at deciphering what it means. And sometimes I can't, but usually I can now. Actually, we had a Christmas party this Christmas, and we were talking about Sarah's texting, and everyone in the room was in like nice attire. And I was sitting in this room right there in like a really tacky, ugly Christmas sweater, because I had read the message and I was like, I'm so good at interpreting Sierra's text. And they're like, but you're not, because
wore an ugly sweater.
You wore the ugly sweater because Sierra's message was we had to decipher it a bit. And I did it wrong that one time, but I am generally good at it. Oh my God. But it's one of those things that's an ADHD symptom, is just like,
it's not in the DSM-5.
No, it's not.
Right. But that's the hyperactivity and inattentive. It's like a blend of different things, right?
Yeah.
Like speaking about, I just want to, like, we go through, as a child, what did that look like? So Amanda's known me since grade 7. So you didn't really know me in my youth. And honestly, I don't have a whole lot of memories from.
No, you in your youth didn't know you in your like childhood.
Yeah. Like I don't have most people can't remember their childhood that well, but I have a few like distinct memories from school where it was obvious that I was like different from other girls. So one was that I did have to leave the classroom. I was the only person, or there'd be like another boy in me that had to leave the classroom, get extra help with reading, writing, etc. So that's something that happened in every class that I was in throughout elementary school. And then I remember, my grade 3 teacher, who is my sister's now mother-in-law, I remember she said to me, this is the only thing I remember from a teacher saying anything to me. She looked at me. She was so mad and disturbed. And she's like, what's wrong with you? Like, do you need to like clean your ears out? Like, are they full of wax? And I was like, what? And I remember like leaving that day feeling so insecure about my ears and like just worried that they were like disgustingly full of this like goo, because I had no idea what she was talking about. But she was like obviously knocking me for like not paying attention, or I don't even know. But anyway, so these are the little things that I do know from when I was little.
It also speaks to the growing like foundational sense of self that gets ruptured, which we're going to talk about self-worth next time. But it's like that foundational sense of self that gets impacted by not knowing that you have this diagnosis.
Totally. So I just like that whole time, obviously I knew I had to get extra help. My parents like wasn't really on their radar either. I don't even know if they knew that I had to get extra help. Like they weren't super on top of that either, as far as like whether I did good or not. I don't know. It wasn't like some families are like, we need you to get A's. My family didn't really care. So it was not a big deal if I got a C or whatever.
Yeah. So there's pros to that.
Yeah.
For sure.
And then like adolescence, so teen years, what would you say if you were to, that's even tricky too. Because I mean,
because I was a teen too.
Yeah.
So it's like complicated teens.
It's like a hormonal phase too.
Yeah.
Like just hard to say what parts of that. I know that I skipped school a lot, probably more than anyone, like any of us. Like I just wouldn't go to school. I'd sit home. I just watch TV, go to Tim Hortons, like for no reason. I wasn't hanging out with anybody, but I wouldn't attend. That was something where I was like, I couldn't be bothered to go to class.
Yeah. Which is hard too, because we skipped school a lot together.
Yeah, we did. Everyone skipped. So that's even hard to say as far as like what was what. I think more like adulthood is kind of when, I mean, my impairment was more obvious in the last few years, I would say. But
I think one thing that's been true forever is like sometimes like flexibility in situations. Like if Sierra switches something with me, I'm like pretty good at being like, oh, okay. But I've learned that like, and that we've had conflict over that. Like if there's something and the plans change, I'm like, oh, like I can't, I'll be there in an hour. Like that hasn't always gone well, especially pre-diagnosis and like
that's the paradox of it is like, it's okay if I change the plan.
Yeah, because she does that. Yeah.
But that, and then I would say the confidence piece, and even like for those of you who know like rejection, sensitivity, dysphoria, that's something that's evident throughout like childhood, teen, adulthood. And mine is like, I don't want to say unique, but it's something that I brought up with my counselors in the past, like being like, I'm always worried that people think that I'm lying. It's just like this weird thing, like, like, are they going to believe me if I say this? Like, it's just like a weird thought that comes in. I'm like, why do I like, that's the most ridiculous thing ever, but just constantly like worrying about what other people think. But it's not an anxiety thing. Like it's clear I'm not
anxious.
I'm not an anxious person whatsoever, but I have these very clear, specific like thoughts that constantly, it could be you. And I'd be like, will she believe? Like they're going to think I'm lying if I call in sick or if I'm sick. Like my patients are going to think that I'm like, what? Like I'm an adult. Like why would I?
And that's where
it's so interesting where you're just constantly doing like trying to predict, and like you perceive people, you think people are thinking negative things even when they're not. And you try to read into little things that don't mean anything, but to you it does. So then it gets you in a bit of trouble.
And that's where we see some overlap between ADHD symptoms and like
anxiety,
a trauma perspective, a life. And that's where it's like, we do see some overlap between trauma and ADHD, because when you're showing up in your life and in people around you in sometimes a certain way, then sometimes there can be overlap in being treated a certain way, which, this whole internal dialogue gets established. Like I have that same thing, but mine's definitely more trauma based, where it's like, people that I love deeply, I'll be very worried people are mad at me.
It's specific to them.
It's specific to only close people. Like I have to like check my thoughts a lot. Like even with us, even now, I'll be like, wait, what? And it's like that, but that's not ADHD, but it's similar. It's just different. Right.
Yeah.
But I think it speaks to that like foundational sense of self. Once you have these like deficits that you're treated differently, right? Like ADHD is known to be like rigidity, and it's not like the nicest word, but rigidity fits you well.
Yeah.
And that if you're in a relationship, romantic, or like your best friend in the world, that can be tricky to have that rigidity piece. which makes the diagnosis so helpful, because then when people can understand that, like, it's just an executive, because
she can't get mad at me anymore is what she's saying.
I mean, I can a little, but ADHD it's an executive functioning deficit. So your whole front of your brain does not have enough dopamine to function properly.
You can't flip the switch. That's what happened. You like, it's just things happen too slowly in your brain to be able to wrap your head around something like that quickly. That's why you need processing time, and then you'll come back and be like, oh, it's okay. But speaking like rigidity, and that's another thing I wanted to bring up is family history. And my family history, if you don't know your family history, this is another barrier, because I didn't know, other than my little sister Haley, which was very clear that she had it, and she was medicated when she was quite young, so she was one of the like lucky ones.
More hyperactive presentation.
Yeah,
though.
so it was like more overt, like it was just quite obvious. I could like as a teen, because we're 10 years apart, like it was obvious even to me. But so she had it, but I didn't know that my dad had it, which he never did get assessed. But he's rigid, she's rigid. I'm like, we have such similar character traits, and I didn't get raised by my dad. I saw him every 2 weeks for my whole life until I was 16. He didn't have a social influence on me in that way, and yet I behaved so similar. I was like, how is that possible? Like, how does that work? Why am I not like my mom? Very different. But he has ADHD. My auntie Nazi, his sister has ADHD. His other sister Becky has ADHD, and then his third sister, question mark, I'm not sure. But I wasn't even aware of my aunt's history until this last year, when I started kind of trying to learn about it and figure it out. And oddly, as a teen, actually, this is another thing that happened. I got compared to my auntie Becky. This is another thing. I job hopped as a teen.
Oh yeah. Oh man. I would get Sierra, like I would maybe work somewhere first, and I'd be like, oh, you should hire my friend. She's amazing. Like, bring her on. Gosh. And then she'd come, and then she'd work for like a week, and then she'd be gone. I wouldn't tell it. I wouldn't show up. And I was like, ugh.
I would just avoid, and I just wouldn't show up. Yeah. I think I probably had over more than 20 jobs before the age 20. Yeah. And maybe, I don't even know, but that was like a very clear, I brought this up to my mom. I was like, do you know that was like an ADHD thing? She's like, what? Like, how?
But see, so it's internalized by your family and this is like a personality structure, which is not what it was.
They're still very stuck on me being defective. Trust me. I know. I know the perception of my family. Well, my mom anyways, and my stepdad.
Kelly, don't
I
watch
apologize.
this episode.
Yeah, sorry. Actually, my stepdad, he's a bit more understanding. He's like, I think has a bit more context because he has his own mental health stuff. So he's starting to understand. But my mom, bless her heart.
Bless Kelly's heart. So we're talking about the hard bits of ADHD, and I think we can trace back over your life, and we can see some of the things that like make a lot of sense. Yeah. But I think it's also important to talk about how ADHD has been in a lot of ways your superpower. Like when we say you're not for everyone, I think there's still some truth to that. I think there's truth to everyone, but I think it's also because you're like this incredibly like strong, like you're such an amazing human. And part of it is because of the way your brain functions and how like, this is a single mom who raised a kid. Like, oh, we should not get emotional on this podcast. Let's just take a little breath. But like against a lot of odds, and like became a doctor.
Yes, I did.
And part of that's because of the way your brain functions.
No, it is. I would have to say, so with that, like I always said, like thinking about me, my sister, the kind of phrase that comes to mind is you need to use your powers for good, not evil. Yes. And I didn't know what that meant for me. I didn't know I had ADHD. I knew that I had this like brain that ran 1,000 miles a minute all the time. And unless I had a direction for it, it's chaotic. It was just chaotic. And I couldn't direct my focus or find my place or settle down or land anywhere that felt comfortable until I had a baby. And then I went to school and I fell in love with the academics and the courses I was taking. And so it just gave me such a clear thing to focus on. And so directing my energy in a positive way versus when there's nowhere really specific to put it or place it, like that was the problem. I was more, I think I would say I was more irritable, angry. Like there's a lot of different traits that weren't great because of the ADHD. So with academics, pros and cons, but with academics, it just gave me a clear outlet for that. Yeah. And it's not normal to be a single mom and go through the extremes that I did, but in my mind, it didn't even seem like a big deal. And I always said that. I was like, well, I don't know, like, what's the big deal? Everyone would be like, how are you doing that? I'm like, well, I don't know anything different. I'm just doing it. Like, it's just fine. And it never really, I didn't think it was a crazy thing to do, but that's what I do.
It's very much an outlier thing, right? Because ADHD can be a deficit in that you couldn't have done those things, but you were able to sort of like channel it in a way.
Yeah.
And then the other piece that I think is a superpower would be like, yeah, there's pros and cons to this one too. We joke about them a lot, but like Sierra will say what she thinks. And I can be a bit more people pleasy. I can kind of, which has its pros too, but Sierra will speak her mind and you always know what she means. Yeah. And it's always very just like forefront, which definitely, again, pros and cons, but that is a skill that I think, especially as women, when we talk about being socialized to be like quieter and submissive, that's something that you've never been. And that is
And I don't
rare.
even perceive it to be like,
no,
sometimes I don't even perceive it to be like bad. Like Amanda would be like, Sierra, like shut up. And I'm like, what's the big deal? An example with Dana's house, when we were doing, our friend was giving us a tour of her like newly renovated home. And we go to the bedroom and she had painted it blue. Yeah. Was it the roof or the walls? The walls. And so she was really happy because what did she say? She wanted
to look like a cloud.
She wanted to look like a cloud.
Which is nice.
I can't remember how I responded, but it wasn't the right way.
No, she was like, oh, what?
Why would you do that?
Why would you do that? And like, that's a harder example. And she was like, and I was like, Sarah, we had a chat on the drive home.
I was like, and again, I was like, well, like I'm being honest, and Dana knows me well enough. She's not offended. No. She's just like, whatever. But the flip side to that too is that I know well enough that there are certain situations that I do have to cap it in my work, for example. And so it's exhausting.
So that speaks to the, again, benefit of diagnosis and being able to say I have ADHD. And so there's things I need to work on. So there's things I need to like pay attention, that if you're texting someone where maybe it's like a bit more serious, you're going to have to take more time to be like,
exactly.
Oh, yeah. Or like, okay, I do have this part of me because I have executive functioning issues. Yeah. And I'm just going to say it right away. I need to, and which is a lot more cognitive effort, which is why this is such a deficit for people, is because it's a lot more effort to have to go through that.
Just training. Yeah. So I, like 2 years ago, I really started to tank at work, and it was borderline where I'm like, am I going to have to quit my job? Like I couldn't function after work. Like I could not function. I'd come home and lie on the couch. I was like, to my kid, I'm like, I can't talk to you. I can't talk to you. Like I had nothing left. I was like, what is this? Like something's got to give. And this is before diagnosis. I was like seriously contemplating, like this might not be for me. Like maybe it's my career. Maybe I'm just not driving with it. Like it was just very confusing, but it was just like, I'm not going to get into all the things I have to do in a day, but with the type of struggles I have with ADHD, it just becomes a lot. It's very overwhelming. So by the end of the day, you're just like, there's zero left. You've put in 1,000%. It's like you just ran a marathon and you're just dead.
Which pros and cons too, because if you worked at a job that wasn't stimulating you constantly, you would tank in a different way.
I would have quit.
Yeah.
That's what I just would have quit.
Kind of like your adolescence.
Yeah. So.
But now, because you know more, you'd probably tell someone before you quit.
What's that?
You tell people now because she's learned.
Exactly. I would have never just, I mean, there's a lot of things that have changed. I've done a lot of work on myself.
Yeah, absolutely.
A lot of ways without knowing I had this. There's been a lot of work I've done.
Yeah. And we both have. And I think that's what makes this episode of just why are women missed? And I think there's a lot of reasons. And then just like this example of this like very successful, beautiful, wonderful woman who's lived her whole life without knowing that. And I think it's to have, if you're watching this and you've kind of maybe thought like, oh, like get assessed. Like it's a very serious, I said that.
Get assessed and then get support, get treatment.
Yeah,
like that's assessment's like great, but then if you're not going to treat it, and a lot of parents like go back and forth on this, and we'll talk about this in a different episode, but like treatment, whatever that treatment looks like for you and your comfort, just do something. Do something. Yeah, we won't get into details, but yeah. Now, something fun that we thought about doing to close this off was we're just going to go through the DSM-5 with you and see how many things I would check off. Like just right now, as an adult.
We'll just do it quick.
Yeah.
So say them properly.
So the DSM is what like your GP or your psychiatrist, psychologist would run you through. Typically just ask these questions. And if you check off 5 or more from both categories, and then there's a subcategory to that, then and again, we're not diagnosing you. So if you start checking this off, you're just
It's not us.
We're not assessing
people.
you. We're just giving you an example of what this looks like and why people can or do get missed.
So we both know this off our head, but I want to read it with the right language. So I'm reading it. So criteria A is persistent patterns of inattention or hyperactivity or impulsivity. So you need 5 here. I think if
you're under 17, you need 6.
Yes, that's right. So this is, so I'll read this. Let's go through this one. If I read them all, this will take a long time. So fails to give close attention to details, careless mistakes at work or with finances. So we talked about texting there. That's that.
It has to happen in one or more settings too. Yep. So check.
Difficult sustaining attention in tasks, meeting, reading, or conversations. Meetings. Appear not to listen when spoken to directly.
What would you say about that? Comment on that.
I mean, yeah. But you also sometimes don't listen. So we have a lot of fights. I'll be like, I said that. And she'll be like, no, you didn't. And then I'm like, yes, I did. I often say like, we need to record ourselves, which we're doing now.
She's not always right.
I often am. Do not follow through on instructions, difficulty finish tasks, difficulty organizing tasks and activities, time blindness or overwhelm, avoids or strongly dislikes tasks requiring sustained mental effort, frequently loses items. Sierra has left her car, keys, her phone, computer, I think
was. It was my laptop on
and
the
she
top
just like
of
drives
the roof
away
of my car.
and it just like flies off her car. She gets it back though. The universe is in her favor.
Yeah.
Easily distracted by internal thoughts or external stimuli.
Yeah.
Forgetful in daily activities. So appointments, bills, returning messages. I think before, but I think you've worked on that one.
Yeah.
So, I mean, you've worked on it. So
totally.
So, and then, so hyperactivity and impulsivity. This is A2. Adults, 5 symptoms present for at least 6 months. So the other thing is that this is not situation dependent because a lot of this will show up after acute trauma. This isn't what it means. It has to like be for a long time.
Starts before the age 12, has to persist for more than 6 months, has to impair your life in some sort of way. Yeah. Those are kind of like the broader criteria outside of these like checklists. So in the first category, I think I checked at least 6 or 7. Yeah.
And so these are just more, so restless.
So this is the hyperactivity section. So this is where you get missed in my eyes. So read those.
Hyperactivity and impulsivity. Well, this is where a lot of boys show up.
Exactly.
Like in class.
Yeah.
Right? This is the more typical that isn't missed. That's what you meant.
Girls get missed. Yes. Boys do not.
Yes,
That's what I'm trying to say.
They meet this
is where girls get missed in this category. Yeah.
So they're restless, feeling on edge, difficulty sitting still for long periods, feeling driven or overly busy, unable to relax, talks excessively or interrupts others.
So I would get that. Was that 2 or 1? The one before the talking excessive, was that its own? Are you kind of...
Yeah, so that's 4 down.
The one before that one, what was it?
Example of not listening. Feeling driven, overly busy, or unable to relax.
Okay, so I would meet both of those. So
blurting out answers or finishing other sentences, difficulty waiting turn, impulse decision making. So I see this a lot in my practice. So overspending, quitting jobs, and issues in relationships.
Yeah.
So the criteria B, several symptoms presenting before the age of 12.
Yeah.
They don't have to be diagnosed in childhood, but they need to appear before. Criteria C, symptoms present in 2 or more settings. So work, homeschool, relationships, parenting, academic, or training environments. Criteria D, clear evidence of functional impairment. Criteria E, symptoms are not better explained by another condition.
Yeah.
So looking at like
ruling out a lot of other things. You can't just be like this. You have to consider a lot of other factors before you can like really like, because again, so many crossover symptoms with so many other conditions. That's where you really do need to get hooked up with the right skilled practitioner.
So it's like quick and dirty. But like
with that said, like had I been assessed probably when I was little, I would have met the criteria. I would have met their criteria.
Well, yeah, because you have ADHD.
But not everybody would act like, well, what I'm saying is that if I got assessed, I would make the criteria for the inattentive, but not all females are inattentive. They're hyperactive. This is what I'm saying is that let's say I had a different set of symptoms because not everyone presents the same and they're more the hyperactive, like a hyperactive 5-year-old female or 7-year-old female. They would get a miss because that's where women internalize a lot of symptoms where it's more anxious thoughts. It's perfectionism. It's that. So it's, if I got the opportunity for assessment, I probably would have got diagnosed, but not every little girl or teenage girl or even full on adult female will meet the criteria and get the diagnosis.
Yeah. And a lot of girls present with more of the inattentive. So they're not jumping off the walls. And it's such a different presentation, right?
It's catch-22 in several different ways. Yeah.
So that's all we have, I think, today.
Yep.
That was a good conversation.
I think so too.
Thanks for listening. Next time we're going to talk about, or watching, I guess you're listening or watching. Next time we're going to talk about self-worth, which is such a huge one too. And just talk about how does that get all impacted? Because it sure does.
Totally.
Especially in women.
Stay tuned.
Thank you. This podcast is for informational purposes only and does not constitute medical or mental health advice. We're not your doctor or your counselor. Please contact your own healthcare providers before you make any changes to your health and wellness protocols related to your body and mind.